Hello, everyone. My name is Brittany Larrabee, and I am honored to be here today to talk to you about a topic that's very near and dear to my heart, and that is suicide prevention. So a few logistical things. As you can tell, this is being recorded. I am not a doctor, psychologist, or medical professional of any kind. So if you or someone you know is experiencing mental health challenges or has suicidal ideation as a harm to themselves or to others, please reach out for support and I will share how to do that a little later. My lovely colleague, Crystal, is going to be managing the chat function as well as the Q&A. So please do feel empowered to engage as we go throughout this presentation. I will be sharing from trusted resources as well as my personal experiences, but as I mentioned, by no means is this medical advice. So as a quick reminder, Borslow Insurance offers a variety of health and well-being services to support you and your organization's efforts to improve a culture of health and well-being and to help reduce claim spend as well as provide an amazing experience for employees. So please do reach out to your point of contact at Borslow, your consultant, if you have any questions or would like to get in touch with us. So today we're going to be taking a look at a variety of different helpful information. We'll take a look at risk factors, warning signs, because awareness is key. So to know what to look for is very important. I will share a personal story to help you relate and to give you some examples. We'll talk about hope and recovery and how that is possible for everyone and what that can look like. And then I'll share some specific ways that you can help yourself if you are struggling or specific tips to help someone else if they are struggling. And then we'll recap and tie it all together. Before we get into the risk factors and diving into the presentation, I wanted to ask a question. Suicide is what leading cause of death in the US? Is it the 10th, 12th, 14th, or 16th cause? Give you a minute to think about it. Is it the 12th leading cause, the 12th, 14th, or the 16th? The correct answer is 12. So suicide is the 12th leading cause of death in the United States. All right, so looking at the risk factors, this is not an all-encompassing list by any means, but I do want to highlight a few. If an individual has an existing mental health disorder, that does substantially increase their risk for suicidal ideation or getting to that point of thinking about committing suicide. Looking at a person's alcohol or substance abuse, lack of health care, especially mental health and substance abuse treatment, cultural beliefs such as a belief that suicide is a noble resolution of a personal dilemma, lack of social support, if they have been exposed to others who have died by suicide, any extreme change like a job or financial loss of a relationship, etc., etc. So once again, this is not an all exhaustive list, but this does give you an idea of things to be looking for, especially if someone opens up to you or if you yourself have experienced one or more of these. So another question before we move on to the warning signs. In 2020, how many people do you think died by suicide? The correct answer is 45,979 people died by suicide. So that could be someone in your community, that could be a friend, a family member, a colleague, a total stranger, but putting a face sometimes helps make that number a bit more meaningful. All right, for warning signs, same thing. This is not a completely exhaustive list, but it does give you an idea of what to be on the lookout for. If someone specifically is talking about wanting to die or killing themselves, that's a big red flag. Looking for a way to kill themselves, such as searching online to buy a gun. They're talking about feeling hopeless or not having a reason to live, feeling trapped or experiencing unbearable pain, changes in sleeping habits, if they're sleeping too much or too little, withdrawing, isolating themselves, extreme mood swings. These are all things to be aware of. So in 2020, there was an estimated 1.2 million suicide attempts. I don't know about you, but one, I'm surprised that number is not bigger, but two, that's scary. So knowing warning signs, knowing the risk factors is important because this is something that we can all help prevent. And knowing that it affects so many more people than you can really see on a day-to-day basis is important to be aware of. So now I'm going to share a personal story. If you can't tell, this is a picture of me. I want to make this clear that my intention is not to make this the Brittany story. In fact, my intention is to share from a place of relatability, to share so others can see themselves in my situation. I know I don't hear stories many times, and I have been looking for stories that I could relate to. And I find that when there's someone who can understand and shares the ins and outs and the details, that can be really, really helpful and can help me feel less alone. So as a healthcare or someone in the health and wellness space, and looking at the data and being surrounded and seeing and hearing how much our all of us are experiencing challenges with mental health, it became abundantly clear that I needed to share my experience so that others could see that this is one story of what it can look like. So without further ado, the reason I wanted to share pictures is this is a picture of me from sometime June, July of 2021. And it's interesting because this shirt that I'm wearing, it says grit on it. I'm driving a moving truck. This is from the same day. And while you might see a smiling face, probably nothing looks wrong in this picture. I had just had a panic attack not that long ago, like that day, that afternoon. And this was me trying to come down from that. So I wanted to share the picture for that reason, so you can actually see that sometimes the picture, we can't always see what's going on in a person's internal world. And that's okay. We're not supposed to be able to, but we never know what really is going on unless they decide to share it with us. So taking a step back, I want to share how I got to this point. As a lot of us have experienced, a lot of change. So you had COVID, I ended a long-term relationship. I moved back home with my parents for 7 months. I worked with my doctor to wean off of antidepressants because I was truly convinced, just like if you're on a cholesterol medication and you're eating healthier and you're exercising and you're sleeping and you're doing all the things, you might want to try getting off of medication because your body is in a different place. And there's lots of people who can do that successfully. So I was wanting to try to wean off of my antidepressants because my lifestyle was drastically different. I had the support system that I needed. And I really thought I was going to be okay, that I didn't need to be on antidepressants for the rest of my life. And my doctor was very supportive. You know, we talked about what that was going to look like, and it was going to be a very slow weaning off process. And I actually weaned off the day of my birthday, which felt kind of monumental and it felt exciting, right? The less medications, in my opinion, the better if I don't need them. Well, as you will learn, I did in fact need them. But continuing along, so I'm living with my parents, family dynamics, need I say more? We love them, but it can be challenging at times. And then after living with my parents for 7 months, I moved out onto my own, which drastically, desperately needed to happen. But it was out into the country and I didn't know anyone. And I was about a half an hour from that support system that I had been, and from an area where there were plenty of things to do. And I felt very isolated. I was just living with my cat. So along with that, you know, I was trying to build a side hustle to make some more money so I could, you know, take care of myself the way that I wanted to. Someone I admired and looked up to that I had been working with, not through my company, but in another kind of personal setting, broke my trust. And that really, really hit me hard. And then I'm not going to lie, I was definitely self-medicating with alcohol because we're being social, right? Go grab a drink, right? It's easy, it's fun. And I just was not in a headspace where that actually ended up being helpful. So all of these things, like one after another, kind of piled on and on and on and on and on and on and on. And then what happened next is on Sunday, August 1st, 2021, after having some fun with friends, trying to have fun, I had some drinks, trying to self-medicate, trying to have fun, which FYI, alcohol is a depressant. So if you ever are feeling depressed or you're going through some challenges with your mental health, I strongly encourage you to stay away from alcohol because it will depress. It will make you feel worse. So the next morning I woke up and I felt really overwhelmed and an extreme sense of loneliness. I felt empty, I felt anxious, I felt a level of emotional pain that I wanted to get rid of immediately, and honestly can't remember ever feeling it. It almost felt like I needed to escape my own body. And I was really sick and tired of feeling this way. And for a little bit of history, my 20s were, so a decade, was me struggling ups and downs, depression, anxiety, on and on and on. So this had been a struggle, a battle, if you will, for a while. And I was exhausted. But because, asking for help is a skill, that is my motto I have always going in the back of my head. I realized once I started having some suicidal ideation, which is having thoughts about, I just can't do this anymore. I don't want to feel this way. It would be easier to not be here. All of that. I wanted to end the pain. I didn't actually want to end my life, but I wanted to end the pain. And I was starting to think about how to do that. And that was really scary and extremely uncomfortable. But I knew that I couldn't hold that in. So I told my sister. And I shared with her exactly what was going on. And I'm the big sister. I'm 3 years older, right? I didn't want to put my baby sister in that scenario while we were with my niece. I didn't want to have her be parental over me, but I knew I needed to ask for help. So the next day on the drive back, because we were visiting friends in Massachusetts, I drove back home And I called a couple local inpatient mental health programs, and the wait was 4 weeks. So I could not get in for 4 weeks. And I knew by that time I'd be in a better place. I needed the support here and there. So I got to experience the access challenge that so many people are facing today. And then the next day, Monday, August 2nd, with my mom holding my hand, I remember sitting on the couch, I called my manager, which was probably one of the scariest things, because at the time, I felt like I was failing. My brain could not function at the normal capacity. I was in survival mode. And I felt like a failure. And it was very embarrassing to be sitting, talking with your manager while crying, holding your mom's hand. It's not where you want to be at any age. But without any hesitation, he told me to take care of me and to take as much time as I needed, which was the most liberating. And I do not take for granted the amount of work on the back end that I didn't see for everyone to scramble and make that work. But to be in that space where someone says, take care of you, make yourself a priority, was huge. So with that being said, just be very mindful about when someone's in that really sensitive spot. What you say and how you act really, really does have an impact. So I'll forever be grateful that I had the support from my manager to actually take that time. So after that conversation, there was no question, take the time. And then later that day, maybe like an hour later, a mental health professional came over to my parents' house, and I stayed there for the next couple of weeks because I was not going to stay by myself. And we sat on their swing, and they completed a mental health assessment. And it was wonderful to have someone neutral who wasn't, who wasn't so high emotion, right? Like my family, they didn't know how to handle that. So to have someone that was neutral, could ask the questions, without having to wear what I was experiencing on them, it was best for everyone. So we went through that. We found out that I was not, in fact, a risk at hurting myself. So that was what that day looked like. And I want to share that this is just one way that it can unravel. This is just one story of how this can look. This can look very, very different. But the big thing was that I asked for help. And asking for help, as I've mentioned, is a skill. It's a skill just like, working on a muscle, or if we're presenting, right? We're trying to reduce the amount of ums and likes that we say, which I'm sure I've said a couple. If you are trying to, any skill, it's practice, right? It can be strengthened. And it's the same thing with asking for help. And it's really, really important that we ask for help when we are in need. And to give you a current real-time example, even just this week. So this story that I told you, this was last summer. This week, some things have occurred, right? Life happens, life challenges, things build up, dynamics change, situations change. And we lost a family member. And I found myself in a place where I was in my head a lot. My counselor, my therapist is gone this week, so I didn't talk with them. I journal a lot and I write a lot so that I can get everything out and kind of process on my own and kind of tell myself the things that I need to hear without necessarily having to lean on others. And I ran out of my journal and just all this stuff kind of to bubble up. And I didn't feel like I had that support system that I needed. So what did I do? I worked out, I got a journal, and I started to write things down. I reached out to those people who I knew would be available and could handle that space that I'm in. And it was really uncomfortable. Still, it's this ever evolving way of learning how your body and how your brain and what you need for your own mental health. So it's this ongoing journey, just like healthy eating, right? You can eat a salad and all the healthy things yesterday, but today's a new day. We have to reassess, what does your body need? So it's the same thing with your mental health. So once I asked for help, here's what happened after that. And this is what asking for help does. It gets you what you need. So I took a mix of vacation and short-term disability for the entire month of August, August 2021. Started working with a counselor twice a week. And we met for, it was like 2 to 3 weeks, which was wonderful. She was amazing. And then I realized I actually needed a little bit more support. So I switched therapists at a different point. And what I have used is Psychology Today. I found that has been a very helpful tool in me finding therapists that will address the needs. And they've got a bunch of different filters. So you can filter via, like insurance, gender, all of those different pieces. But, I'm meeting with my counselor twice a week. And in the meantime, even though I was very uncomfortable, I colored, I walked, I hiked, I journaled, I read, and I Netflixed my way through this discomfort. In many ways, I'm not going to lie, I wished I was working, because if I was working, I would have had a focus. I would have had a distraction. And trust me, this was no vacation. But as I mentioned, I started working with a psychologist who can prescribe medications. So he could kind of manage and working through what had come up and why and all of that. And the amount of healing that has occurred since then is phenomenal. I honestly feel, even though there's still challenges, like the most confident, authentic, free version of myself that I have ever felt in my life. So the big takeaway is that, life is always going to throw curveballs, and it's really important that we continue to assess the tools and support systems and our own self-awareness so that we can take care of ourselves and advocate and ask for what we need. I still get overwhelmed. I still get anxious. I still get sad. That's life. It just is what it is. So I want to pause here for a moment. And I really want you to think, do you know someone who has been affected by suicide or mental health challenges? Have you yourself, has someone in your community? Because chances are we are all affected by this. And it is all of our responsibilities to take care of each other as a community, but to take care of ourselves. Put yourself as a priority, 100%, whether it is you yourself experiencing challenges or it's someone that you care about. Hope and recovery. Even in the times when you feel the most hopeless for whatever reason, even when it doesn't feel like it's possible or it's there, hope and recovery is always, always, always possible. For me, it was reading stories of other people who had made it through this dark place, this hopeless place, and came out on the other side from a suicidal attempt or from suicidal ideation or just mental health challenges in general. To read those stories, to hear over and over again, like, I'm not alone. There are other people who have been in this boat. They've gotten the tools and support that they need. They are now on the other side. There's still the possibility that I can access joy and peace and contentment and laughter. All of those things are still possible. So constantly, even when I didn't feel it, reminding myself. So just know that hope and recovery is always possible. If you yourself are struggling with mental health challenges, with suicidal ideation, or are actually thinking about hurting yourself, these are the 5 steps I want you to take and that are recommended. So it's not just about me, but these are recommended by lots of different resources, which I'll share at the end. Find a therapist or a support group. Number one, build a support network of people that you trust, people that you feel comfortable and confident talking to. And then not just build it, but use your support network. They can really, really help you cope during these difficult moments. And it's an important step in the getting help process and moving forward. Make a safety plan so that if and when you do reach that point again around harming yourself, you have a plan. Share it with those that you trust, and then get more information. Continue learning about mental health, continue learning about suicide prevention, continue learning about yourself and self-awareness, because knowledge is power. And what to do if someone you care about is struggling. And in my experience, because I've lived this on my own, and I know people who have struggled with mental health challenges, as well as a friend of mine did commit suicide. So I very much understand how painful it can be to watch someone else you care about. And especially you don't know what's going on in their mind. And that's the scary part. But even though it's hard to know what to do during a suicidal crisis and the feelings all over the place and how to act, there's a number 988, which I'll share at the end, that you can call anytime to help yourself or a friend that's struggling, and they'll walk you through every step of the process. So contact a Lifeline Center, 988. Never keep it a secret if a friend tells you a plan about hurting themselves. Use the do's and don'ts. And the do's and don'ts are tips and talking points to help to talk about a very difficult subject. So just a couple, there's a whole list. I'm not going to go through all of them. Be willing to listen, really actively listening. Allow someone to really express themselves, accept those feelings without having to change them. Get involved, be available, show interest and support. Get help from people or agencies specializing in crisis intervention and suicide prevention. So that's getting that educational piece in. And a couple don'ts. Don't act shocked, because that is most likely going to put distance between you. And do not be sworn to secrecy. Seek support, because in that crisis, it's overwhelming and you yourself are going to need support as well. Just like in any caregiver role. Be aware of suicidal feelings. So people having a crisis sometimes perceive their dilemma as inescapable, or might feel a complete, utter loss of control. And these are just some of the feelings and thoughts people experience when they're in crisis. So if you're noticing a lot of these comments, that's another reason to reach out. If they're saying, like, I can't stop the pain, I can't think clearly, I can't make decisions, I can't make the sadness go away, I don't see a future without pain, I feel hopeless, I can't seem to get control. Those are all things to be aware of. Use the 5 action steps. Ask, be there, keep them safe, help them connect, and follow up. And then get more information. And practice active listening, as we've talked about. Really listening to someone and what a person is saying is extremely important. So as a quick recap, what do we do if ourselves or someone we know, someone we care about is struggling? 1, know the risk factors and warning signs. Awareness is key. 2, ask for help. It's a skill. Encourage those in your community, those that you care about, to ask for help. It's a skill, right? You yourself ask for help. We all need and deserve help and support. 3, hope and recovery is possible for everyone. The amount of tools and resources available are there. And if you don't know how to access them, I can guarantee you there is someone there to help you find those resources. And take the steps that we outlined to help yourself or someone else. And lastly, this is the 988 Suicide and Crisis Lifeline. If you or someone you know is having suicidal ideation, is at risk of hurting themselves, 988 has been designated as the new 3-digit dialing code that will route callers to the National Suicide Prevention Lifeline. As of July 16th, this is the new code that is available across the United States. So thank you so much. If you have any questions or concerns, please reach out to wellness@borslow.com and we'd be happy to follow up with you and provide more information. This recording will be made available on our YouTube channel per request. So thank you so much. Have a wonderful day and take care of each other and yourselves.